Hello to all, this is Keith, and I want you to think about someone you love. Maybe it's a parent, maybe a sibling, maybe it's you. They go to the doctor every 3 months. They're managing something, blood pressure, cholesterol, diabetes, thyroid. They take their medication every day. They get their labs done. They do what they're supposed to do. And they will do this for the rest of their lives. Nobody asks why. The doctor doesn't have time to ask why in a 15-minute appointment. The insurance company has no financial incentive to ask why. The pharmaceutical company definitely doesn't want you asking why. So let me ask it. Why is the most medicated nation on earth also the sickest nation in the developed world by almost every measure? Because a population that is sick enough to be dependent, but functional enough to keep working and paying premiums, is not a failure of the healthcare system. That is the healthcare system, working exactly as designed. Let me show you the cycle, not a theory. The documented financial incentive-driven cycle that the American body moves through from birth to old age. You are born into a food system dominated by ultra-processed products. The USDA reports that ultra-processed foods now make up over 70% of the American food supply. School lunch programs serve what's cheap and shelf-stable. What's cheap and shelf-stable is processed. Children develop palate preferences and metabolic patterns early, before they have any agency over what they eat. By young adulthood, chronic inflammation, insulin resistance, and weight gain are statistically predictable for a significant portion of the population. Not because Americans lack willpower, because the food system is specifically engineered to override the body's natural signals. There is a $1 billion food science industry dedicated to that exact outcome. The doctor's visits come. High blood pressure, prediabetes, high cholesterol. Here's a prescription. Here's another prescription. Here's a referral. Each prescription has side effects. Each side effect has its own drug. The average American over 65 takes more than 4 maintenance medications daily. That number is growing every year. And in the insurance company, which increasingly employs the doctor, processes the prescription, fills the medication, and analyzes the data, profits at every step. Not from your health, but from your managed illness. They are not treating your condition. They are maintaining your condition. A cured patient is a lost revenue stream. A managed patient is a subscription. Type 2 diabetes affects roughly 38 million Americans. It is the 7th leading cause of death in this country. It drives heart disease, kidney failure, blindness, and amputation. And the pharmaceutical industry generates over $50 billion annually treating it. What they do not run commercials about, type 2 diabetes is reversible. Not for everyone in every circumstance, but for a significant portion of patients through intensive lifestyle intervention, dietary change, and in some cases therapeutic approaches to eating. Blood sugar can return to normal ranges without medication. This is not alternative medicine. This has been published in peer-reviewed journals, including the Lancet. A landmark UK clinical study called DiRECT showed that nearly half of type 2 diabetic participants who went through an intensive dietary intervention achieved remission at 1 year. The results held at 2 years. Remission, not management. Remission. Now I want you to ask yourself a question. How much does your insurance cover for an intensive dietary intervention program with a registered dietitian and behavioral support? Compare that to how much they cover for metformin, for insulin, for the kidney medications that become necessary when diabetes damages your kidneys over a decade of managed illness, for the cardiovascular drugs that become necessary when it damages your heart. A comprehensive lifestyle intervention program runs roughly $1,000 to $2,000 a year. Annual diabetes medication costs average $3,000 to $10,000 or more, and that's before complications. Insurance coverage for nutritionists and dietitians is limited, often restricted, and frequently requires prior authorization. Insurance coverage for diabetes maintenance drugs is standard, low copay, and essentially frictionless. That is not an accident. That is an architecture. And this is before we discuss the overseas research that never makes it here. Stem cell approaches for type 1 diabetes studied in clinical settings abroad. Islet cell transplantation protocols with documented multi-year remission outcomes. Research that gets funded in different health systems that are not designed around pharmaceutical profit margins. I'm not selling you false hope. I'm telling you that the research exists, the outcomes exist, and the financial disincentive to bring certain treatments here also exists, because a treatment that ends the condition ends the revenue. The most profitable patient is not a cured patient. The most profitable patient is a managed one, alive enough to keep paying, sick enough to keep needing. I want to be careful here because I have genuine respect for physicians who are trying to do right by their patients inside a system that makes it structurally very difficult to do so. But we have to have this conversation. Your primary care physician has on average 15 to 20 minutes with you. In that time, they must review your chart, address your current complaint, manage your existing prescriptions, order labs, document everything in an electronic health record designed around billing codes rather than clinical care, and then make a clinical decision. There is no time in that appointment to discuss the peer-reviewed literature on dietary reversal of chronic conditions. There is no billing code that adequately compensates a physician for a 45-minute conversation about food systems and behavioral change. There is, however, a very efficient workflow for writing prescription and moving to the next patient. And if your doctor is employed by Optum, which employs over 90,000 physicians and clinicians, their employer benefits when the prescription flows through OptumRx and gets filled at an Optum-affiliated pharmacy. I'm not saying every employed physician makes clinical decisions based on corporate or financial incentives. I am saying the financial architecture of their employment creates structural pressures that have nothing to do with your well-being. The 15-minute appointment isn't a limitation. It's a feature. Longer appointments mean fewer patients billed per day. Fewer patients billed means less revenue. Less revenue means pressure on the system. The system is not broken. It's optimized. Just not for you. I'm going to say something now that will make some people uncomfortable. And I'm going to say it anyway because uncomfortable truths are still truths. There is a political science framework that has been academically defined for nearly a century. Mussolini articulated it, though he didn't invent the dynamic. Fascism at its structural core is the merger of corporate and state power, not the imagery, not the uniforms or the iconography. The structure, the merger of who controls the economy and who controls the government until the line between them disappears. Now look at what we have documented across 3 episodes. A handful of corporations control access to health care for the majority of Americans. Those corporations increasingly employ the physicians who make clinical decisions. The federal government, through Medicare and Medicaid, is the largest single payer into that same corporate system, creating financial dependency between government spending and private healthcare revenue. The regulatory bodies tasked with oversight, the FTC, CMS, state insurance commissioners, have been demonstrably under-resourced and repeatedly staffed through what is politely called the revolving door. People who rotate in from the industries they're supposed to regulate and rotate back out when the administration changes. And now a new administration has launched TrumpRx, a government-branded direct-to-consumer pharmaceutical platform, giving the executive branch a direct distribution role in the pharmaceutical market. Agreements made under executive pressure, no legislation, no statutory framework. Executive relationships with 16 private companies mediated through a government website. What you have is not a healthcare system with some corporate influence around the edges. What you have is a system where the corporate structure and the government structure have become so financially intertwined that the practical distinction between them is largely administrative. And here's the part that connects everything. When the state controls access to your health through the corporations it protects, regulates slightly, and increasingly partners with, that is a form of population control, not through force, through dependency. A population that requires a private corporation's approval to access its own medication is not free in any meaningful economic sense. A population that cannot afford to question the system that controls their prescription is a population that is manageable. That is not a prediction. That is the current condition. Visible in quarterly earnings reports, documented in FTC filings, testified to in congressional hearings, written in the financial statements of 5 publicly traded American corporations. The most compliant patient in the world is the one who believes they have no other option. And the healthcare system, as currently structured, is extraordinarily effective at producing that belief. You get diagnosed with a chronic condition. You're told you'll manage it for life. You're told your lifestyle can help reduce symptoms, but the medication is necessary. You are never told the medication's profit margin. You are never told the lifestyle intervention outcomes. You are never told that the 15-minute appointment structure exists because of billing optimization, not because that's the amount of time it takes to understand a human being's health. You're told to trust the system, and most people do, because the alternative, distrusting the system that controls access to medication that keeps you alive, is genuinely frightening. That fear is rational, and is also the most powerful tool in the entire architecture. Not the vertical integration, not the rebrand, not TrumpRx. The most powerful tool is making you afraid to question it. I'm not here to tell you to stop taking your medication. I am not a physician, and this is not medical advice. What I am doing is giving you the context that your medical system doesn't have time or financial incentive to provide. So here is what an informed American does. You ask questions, not to be difficult, because it's your body and your money. Asking your doctor, is there a lifestyle-based intervention documented for this condition, is a legitimate medical question. Any physician who discourages you from asking it is not practicing medicine. They are practicing compliance. You search the financial relationships. When your doctor is employed by a large system, you can know that the system is, and who the system is, and what the system is. You can know whether your PBM is owned by your insurance company. You can know whether the pharmacy you're being steered to is owned by the same entity that denied your last prior authorization. This information is public record. You demand accountability from your elected representatives. PBM reform legislation is real. Prior authorization reform bills are real and have passed in some form at the state level. Your representatives' vote on health care consolidation policy is public record. Use it. And you talk to people. The most powerful force in this conversation is the one that cannot be owned. Shared experience. When your neighbor realizes their situation mirrors yours, and yours mirrors your cousin's, and your cousin's mirrors what's happening in every zip code across this country, individual frustration becomes collective understanding. And collective understanding is the only thing that has ever changed a system this entrenched. Watch the pattern, because they will rebrand again. They will restructure again. There will be another TrumpRx, and another Evernorth, and another Centerwell. Another new logo on the same building. Another press conference announcing savings that flow mostly to shareholders. Another magic drug that treats the symptom of the disease the food system caused. But a pattern once you see cannot be unseen. And that is exactly what they are afraid of. 3 parts, 1 system. Part 1, they built a food chain. 5 companies that own your insurance, your doctor, your pharmacy, your data, and pay themselves at every point in the transaction. Part 2, when the heat came, they rebranded, restructured, handed you a government drug website and called it a revolution. The shell game never stopped. They just got better at shuffling. In part 3, all of it lands in your body, in your bank account, in the body of your mother who has been managing her diabetes for 15 years, and in the quiet, growing understanding that a population kept sick, dependent, and afraid is a population that is much easier to govern. They don't want you dead. Dead patients don't pay premiums. I'm Keith. This has been my 3-part series on sick money on KeithSpeaks. If this series has made you think, please share it with someone who needs to think about it too. Feel free to comment if you so choose to do so. I've placed some information in the description of this so you can do your own research. But thank you again for taking your time to share some time with me on Keith Speaks.